vision is by 2028, we will be a 3-site hospital. Our 3-site system will include 3 cornerstone hospitals, Niagara Falls, St. Catharines, and Welland. By the time we get to the 3-site hospital system, patients and families will have access to the highest quality clinicians for aging and wellness, stroke, cardiac, cancer, mental health, and women's and babies. And they will be treated in a very modern healthcare system where we have state-of-the-art equipment, state-of-the-art buildings, which therefore will have best outcomes and best care. Services will be much more connected than they are now because we will have up-to-date infrastructure as well as information systems so that patients and their families' information travels with them.
Cultures with Niagara Health is really made of. It's the opportunity for staff to engage with patients. It's the opportunity for them to engage with each other. Part of my job, our culture department, is thinking about the wellness for our staff, the opportunities for them to feel like when they're coming into a building that they're taken care of and so that they can take care of others.
With focusing our resources at these 3 sites, we actually will enable better recruitment of staff, better retention of staff, and most importantly, best outcomes for patients.
I really wanted to become an ally on this project in order to help alleviate some of the fears of the community and start enhancing that conversation in different areas and ensuring that we are looking at the lens of not just process, not just policy, but the personal touch.
I'm glad that I became a patient partner. I'm glad that I was able to get behind the scenes and understand the decision making that Niagara Health makes. Decisions are made with a lot of thought, a lot of engagement. As a patient partner, I was asked, I was listened to, and I was heard.
We want the region to feel and our staff to feel like we've considered how we can really support best patient care and also support the staff to be able to do their best jobs every day.
Quality care is about people, not about a building. The future of healthcare requires access to family doctors and other community-based care providers. The Niagara Health System is working closely with the communities affected by this change to provide new ways to access healthcare.
We are blessed to be able to have these centers of excellence coming to Niagara and ensuring that Niagara is taken care of as a whole.
You don't want to leave our communities to go and get care outside of the Niagara region. We want that care right in our own community. So for us to transform the way we're doing right now, we'll take those services, those specialty services, and bring them close to home.
We're going to get the best care possible. Hello everybody. Can everyone hear me okay at the back? Yes? Thank you for joining us today to discuss Niagara Health's future plans for hospital care across Niagara region. My name is Lynn Guerrero, and I'm the President and CEO of Niagara Health. I am also a proud resident of Niagara, and I've spent my entire career, 36 years, working in various parts of the healthcare system. Before we get started, I'd like to take a moment to acknowledge the lands on which we gather today. Niagara Health remains committed to highlighting inclusion as a key driver for providing high-quality care. We are committed to continue to listen and learn more about the history and current experiences of Indigenous peoples, and I acknowledge my own responsibility to take meaningful action towards reconciliation in the healthcare system. One way I've continued my own journey of learning and reconciliation is to support the development of our first Indigenous Health and Reconciliation Strategic Plan, which was created with input from many leaders from the Indigenous community across Niagara, and was created by our newly formed Indigenous Health and Reconciliation team. The plan will be launched publicly later on this month. My hope for this evening is that we have a good dialogue, and we look forward to hearing your ideas and your concerns. Our plan to build a 3-site hospital system has been in place for many years. We're very lucky that we were able to maintain momentum over the pandemic, and we're happy to break ground on the new South Niagara Hospital last summer. I'm joined on stage by my colleagues, Angela Zangari, Executive Vice President, Finance, Redevelopment and Facilities and Chief Financial Officer, Heather Patterson, Executive Vice President, Clinical Operations, and Dr. Satish Chawla, Interim Chief of Staff and Executive Vice President of Medical Affairs. The rest of my executive team are in the audience as well. I want to thank any of our partners who are here today from across Niagara and various parts of the healthcare system. This is the third of many in-person community engagement sessions that we're hosting. And as we continue the planning for a 3-site hospital system here in Niagara that will allow Niagara Health to provide seamless care and more specialized services within state-of-the-art facilities. We are fortunate in Niagara to be in the process of building a brand new hospital in Niagara Falls, just a mere 10 years after building a new hospital here in St. Catharines. We're also already in discussions with the government on a massive redevelopment in Welland, where the current hospital is. We're just waiting for a planning grant, so we won't lose any momentum on our 3-site model. Other communities across the province are just starting on their requests for capital projects post-pandemic, so we're very lucky that we have been able to continue our momentum and be well ahead of some of the others. These projects really force us to think about how we are providing care across all of our sites and all of the communities, and we need to plan well ahead, and that's why we're here tonight. We've already been 10 years into this planning, and I want to remind everyone that the changes are still 5 years away. We've been working really hard with municipalities across Niagara as well as the region, the provincial government, and other healthcare partners to look at how we're going to provide high-quality hospital care to the residents in Niagara as we work to modernize the hospital system. My hope is that we can have a productive conversation today and hear your thoughts about the modernization. Before we jump into the presentation, I want to pass things over to our moderator. She's the Executive Vice President of Strategy and Communications at Niagara Health, Harpreet Bassi, who will provide an overview of today's session.
Good evening, everyone, and thank you for joining us. I'm Harpreet, and I'm going to moderate today's question and answer session. The session will be started by today's engagement will start with a presentation followed by a Q&A session. And once we have gone through the Q&A session, if you choose to not participate and you do have questions, you're welcome to put in your questions in the cue card. We also received a number of specific questions related to St. Catharines from members of the community, so we're going to address those right after the presentation. We have staff at the sign-in desk who have cue cards if you don't want to ask questions. We also know that we have members here from our colleagues at Fort Erie SOS and the Ontario Health Coalition. Welcome, you've come to all of our events. But we'll start with people that haven't come to the other events to ask their questions first, if that's okay with everybody. And I'm now going to talk a little bit about our rules of engagement. I know that you've all taken time out of your busy days to be here, and it's a lovely day outside, so I'm not going to read all of the rules of engagement, but what I will say is, can we please maintain respect for the space and respect for your neighbors that are here today, and asking questions and ensuring that people can hear the presentation, but also hear the responses to the questions. We are having the session taped by Cogeco, so if you know of people who wanted to be here and couldn't be here today, please let them know that it will be taped and available on video. It's also being live streamed at this time. In facilitating the question and answer, given sort of the numbers in the room, we'll probably give folks a chance to ask 2 questions, and if there's room for additional questions afterwards, we're happy to have that conversation, but also reminding folks that if there are questions or if there are comments, we'll just acknowledge your comments and move on to actual questions. And I'll leave it at that and pass it back to Lynn for the presentation.
Thank you, Harpreet. Okay. So we believe that every person in our region deserves to live every day of their life in the best health possible. And as a community hospital system, our focus on teaching and learning, research, innovation, and partnership propels us to continually improve care and make a difference in people's lives. In 2023, Niagara Health launched our new strategic plan. The root of the plan is essentially people. You, our patients and our community, and our teams who provide the care. Central to this plan is designing a hospital system around the needs of our patients, their families, and their loved ones. Our goal is to make it easier for you to access quality hospital services and improve your experience. As the Niagara region continues to grow, so too does the demand for healthcare services. Niagara Health helps hundreds of thousands of residents per year through our emergency departments, our diagnostic imaging departments, our surgical programs, and specialized care, including cardiac, kidney care, cancer, mental health, and addictions. As you can see, our hospitals have a very significant role in ensuring the delivery of emergency and acute care services across the region. So it's really essential to recognize that hospitals are but one piece of a very complex healthcare puzzle. And that's why it's essential that we work with partners across the healthcare system. And this picture just indicates who all of those partners are. And we'll start by just saying that primary care there at the top, what that means is family doctors, as well as the teams that support those family doctors. We also have home care, long-term care, emergency medical services, those are our paramedic colleagues, public health, and community health centers. So you can imagine that it's critical that all of these pieces work to their fullest extent for the healthcare system to work as a whole. High quality healthcare is not based on just one thing, like a physical building, and I think you heard that by one of our nurses in the video. Now more than ever, the quality care that we deliver to patients relies on partnerships. This is particularly important as we look at some of the external pressures we are facing, including a shortage of family doctors, a shortage of long-term care beds, and a shortage of healthcare workers across all parts of the healthcare system, including all of these levels. It's also important that we talk a little bit about the types of care that people receive in our communities, because there's a lot of confusion about this, and the more we're out talking to people, the more we realize that we really need to do a good job in describing the differences in some of the providers. So first and foremost and fundamental to the healthcare center service, access to family doctors and other primary care providers is essential to having a high-quality healthcare system. And the research on this is very clear. Access to comprehensive, team-based primary care. So that's not just a single family doctor. Comprehensive, team-based primary care. Available to you when you need it, when you're ill, is the foundation of a high-performing health system across all communities in the world. So this evidence is very clear. Comprehensive team-based care is more than strictly seeing a doctor when you're sick, in fact. It's a team of professionals, including family doctors and professionals such as nurses, nurse practitioners, dietitians, and mental health workers, who assist you in staying well and help you to proactively manage long-term illnesses and chronic conditions you might have. They do your cancer screenings, they manage your medications, they conduct well baby checkups, and the list goes on how these teams keep you healthy. That's what Ontarians deserve, because that is the best care possible. We know that the Niagara region is underserviced in the area of primary care. We are working with our healthcare partners, as well as the provincial government and the mayors across Niagara, to expand access to team-based primary care across the region. The conditions for which people seek care at our 2 urgent care centers are ones that are typically managed by primary care providers in primary care. The episodic care you get at an urgent care center or a walk-in clinic is not the best care. So we will continue to work with the municipalities and primary care partners to increase these services, hopefully to be provided at our current sites in Port Colborne and Fort Erie. We recognize that there will be questions about this, and we look forward to discussing that with you. So a little bit about why we are evolving, and this comes down to 5 basic concepts. So first is an aging and growing population. So our population is growing and becoming much more complex in their needs as they age. So as we extend lifespan of individuals, people end up living with more and more chronic conditions. This is creating quite a pressure on our hospital system as a whole, and as a result, we are one of the busiest emergency departments and are performing the highest number of surgical procedures in the region of Hamilton, Niagara, Halton, Brant, and Burlington. So Niagara Health has grown substantially in the volume of care that we provide. The second concept is team shortages. So like hospitals across the province and across the country, we're facing shortages of healthcare workers across all of our teams. But we are feeling this the most in those who are trained to work in our emergency departments and in our operating rooms. We have over 400 staff vacancies with particular challenges in recruiting nurses, personal support workers, and medical imaging technologists. These shortages reach across all areas of the hospital. And this number does not account for the physician shortages, which include emergency medicine doctors, anesthesiologists, and general internal medicine physicians. We are doing everything we can to recruit new staff and physicians, and we've actually filled over 2,500 positions between April and December of last year alone. So that's 2,500 positions filled in an 8-month period. But we will be dealing with these challenges for years to come. There really is no short-term solution to this problem. And the third thing I wanted to mention is disconnected care. So we do need to evolve to create a more connected care in our system and better organize our services around patients. Niagara Health is still using paper records and outdated electronic systems. This will be changed in September when we launch our new hospital information system. We do not provide certain highly specialized care at some of our sites, and that's completely appropriate. But often residents are confused about where to go for different healthcare needs, and we want to take that confusion away. As well, not just our patients, but our staff and our physicians are also requesting a better connected system for them to work in. The health information system and the 3-site model will go a long way in creating more connected teams and more connected care. Fourth thing I want to mention is outdated infrastructure, and if you visited some of our older sites, you will know this by your experiences. Our current sites in Port Colborne, Fort Erie, and Niagara Falls are old and beyond the point of renovation to meet our future needs. And our site in Welland requires a major renovation and update. So we really need to bring our facilities into the 21st century in order to have a modern healthcare system here in Niagara. And we know that the new South Niagara Hospital will be a tremendous help with this. And lastly, we have limited physical capacity. Again, if you visited any of our sites, including the one here in St. Catharines, you will have recognized this by your experience. We're operating well beyond our current physical capacity. Our occupancy rate is often at about 115%. Our emergency departments are overcrowded. A safe occupancy for a hospital is somewhere between 80 and 90%. So we really do have to deal with the fact that we have run out of capacity. As well, in recent times, we've had over 100 patients in our emergency departments who have been admitted, but without a bed to go to on one of our inpatient units. So you can imagine what that does if you have over 100 patients admitted within our emergency departments across the system. It means that there's no space for patients newly arriving in the emergency department to be on a stretcher, and it backs up our ambulances. So we need to evolve and build new spaces so we can accommodate this growing and aging population that we have here in Niagara. The time is now to change, and we're really lucky that we have a plan that's been more than a decade in the making. I am going to turn the mic over to Angela.
And as Lynn mentioned, my name is Angela Zangari, and I'm the Executive Vice President for Finance, Redevelopment, Facilities, and the Chief Financial Officer here at Niagara Health. I've had the pleasure of living in Niagara my whole life. I'm from Thorold, so just down the road, and I've worked at Niagara Health almost 33 years now. So we've been making excellent progress on our plan to transform care and move towards a model that benefits all residents of Niagara, no matter where they live in the region. And in order to provide the best quality of care to our patients, we need to focus those limited resources and build seamless hospital care across Niagara with 3 cornerstone hospitals: the Murata Family Hospital, short stays our St. Catharines Hospital, the new South Niagara Hospital, and the Welland Hospital. These 3 hospitals will provide patients access to the highest quality of care by bringing together our staffing and expertise. And we're well on our way to achieving our vision to replace outdated, outgrown infrastructure with modern hospitals that will enable us to deliver a truly connected care for our communities across Niagara. We anticipate that all the services will transition to this 3-site model in 2028, so we do have a bit of time to prepare. So in addition, the system will provide access to specialized care in areas including mental health and addictions, cardiac, kidney, stroke, cancer, complex care, wellness and aging, eye care, and maternity care. And while different sites will have their own areas of expertise, all 3 hospitals will work together as part of that seamless system of care. So what that means is that a patient will be able to go to any Niagara Health site, even if that site doesn't offer the services they need. They'll be quickly transferred to the site that does. there will be no wrong door. The future must also include strong primary and community care led by the Ontario Health Team and community-based partners. So what do these changes mean for our patients, our communities, our physicians, and staff? Patients and families will be able to access more care and services in Niagara with state-of-the-art facilities that have modern technology, private rooms, more beds, and services. By building a modern and connected hospital system, patients and their caregivers will be able to move seamlessly between services in our region. And transforming our hospitals and how we deliver care means patients will receive better access to hospital services and specialized care from the best clinical experts. Everyone in Niagara knows the Walker Family Cancer Centre is where to get the best cancer care in the region. Each of our future sites will have similarly specialized programs that will offer the best of the best our local healthcare has to offer. By building a new and modern hospital system, we will also help to recruit and retain more expert doctors, nurses, and staff right here in Niagara. This means more staff providing care to our patients. And by bringing together our teams creates a collaborative and supportive environment that we already have witnessed in the Niagara Family Hospital with our Women's and Babies unit and in Welland, with our Art Care Center, and in Niagara Falls with our stroke care. I really want to emphasize that quality healthcare is more than physical buildings. It's about access to modern equipment and highly trained staff and physicians. So where are we in this process to build this seamless hospital system? We're about halfway there. So the St. Catharines Hospital, the first of our cornerstone hospitals, was completed in 2013. We just broke ground last summer on the new South Niagara Hospital. And finally, we're in the planning for the redevelopment of our Welland site, pending confirmation of a capital planning grant from the province. Our plan is for Welland to provide 24/7 emergency services, various outpatient programs, mental health and addictions, and complex care. So by the end of this process, we'll have 3 modern hospitals that will be Niagara Health. So specifically, our South Niagara Hospital. Our South Niagara Hospital will transform the way we deliver care. Niagara Health and our partners are creating a more modern and coordinated system of care that is centered on patients and their caregivers. The South Niagara Hospital will have 469 beds, increasing the regional capacity by 156 beds. It will offer a full scope of hospital services as well as centers of excellence in complex care, wellness and aging, and stroke. It will also provide 74% more capacity for MRI tests, accommodate 7,400 more seniors wellness visits, and include 12 additional hemodialysis stations. And for our Welland site, it's very exciting to imagine what this could become in the future. But what we know right now, and based on approved plans for the Niagara Family Hospital, the South Niagara Hospital, is that Welland will have 24/7 emergency services with 8 to 10 observation beds, have a long list of outpatient clinics, mental health and addiction program, diagnostic imaging, kidney care, specialists in eye care, and become an administrative hub for our team. Further staff and community engagement is required to submit a proposal to the Ministry of Health for the Welland Hospital. So stay tuned on that. So a lot of exciting news coming for Welland. So we're also really proud of our long-term care home in Welland. Currently, the long-term care home, our extended care unit, and much like the Welland Hospital, is outdated and requires redevelopment to meet the future needs of patients. In March of 2021, the Ontario government announced that 40 interim beds would become permanent and approved an additional 13 beds, bringing the total to 128 long-term care beds. We're working very closely with the Ministry of Long-Term Care to determine how best to rebuild the home and possibly add much more needed long-term care beds to the region. Together, we can rebuild a campus that is more than a hospital. The hospital itself cannot provide everything. With help from our partners, our redeveloped site could include preventative care by community health partners such as nutrition classes, art therapy classes, exercise classes. It could have a family health team, host an academic and teaching campus for Niagara College, Brock University, McMaster University, and Trillium College. Any unused land could be developed for senior supported housing, for example. There could be an elevated transit hub, indigenous and spiritual healing spaces, or even a community garden. And I'm saying all of this so that you can see that there's a number of opportunities for that site, and we have an opportunity to create something truly special for that, for the Welland Hospital. So thank you for your time, and I'm going to turn it over to my colleague. Thank you.
Hi everyone, my name is Heather Patterson and I'm the Executive Vice President at the Niagara Health, born and raised in Niagara Falls. I've worked at the Niagara Health for over 25 years and I'm a proud member of the nursing profession. To provide some context on the improvements of care in the future state that Angela was referencing with the regional hospital system, let me introduce you to Paul, an example of a potential patient. Paul is a 74-year-old retired teacher who lives in St. Catharines. Paul is experiencing numbness in his face and has a severe headache. Paul becomes worried and he calls 911. Our partners at Niagara UMass arrive at Paul's house and assess that Paul is having a stroke. Because of our partnership we have with Niagara UMass, they know that Paul should be taken to the Niagara Falls Emergency Department. Paul arrives at the Niagara Falls Emergency Department and is seen by our dedicated stroke team. He is a candidate to receive TPA or our clot busting drug. Paul is seen by our regional stroke team at the Niagara Falls site, but is unable to be admitted to our stroke unit because of lack of beds. Paul still receives the best expert care for stroke and begins his rehabilitation. After discharge from the Niagara Health, Paul attends rehab services at Hotel du Shaver and a rehabilitation center. In the new regional system, EMS will take Paul to the new South Niagara Emergency Department. The new ED space can accommodate approximately 92,000 visits yearly and an increase of 20,000 visits per year. EMS and Paul arrive, and because of increased capacity in the new hospital, Paul is admitted to our Center of Excellence in Stroke, where he's surrounded by the most state-of-the-art equipment in a private room with the best clinical experts in one location. I'm going to pass it over to Lynn. Thanks.
So you can see the road ahead. With our three-site model, we are committed to improving access to care. Following the opening of the new South Niagara Hospital, all hospital programs and services operated by Niagara Health will be transitioned from Fort Erie and Port Colborne sites to the South Niagara and Welland hospitals, as well as our current Niagara Falls site. By bringing together our limited resources, the three hospitals will be able to offer more specialized care to patients by the best clinical experts by using state-of-the-art equipment. As mentioned, our plan is to redevelop the Welland Hospital on that same site. The new South Niagara Hospital will increase our emergency department capacity for the region. The new ED at the South Niagara Hospital will be approximately 3 times the size of the current Niagara Falls Emerge and will be able to see approximately double the number of patients per day. Following the opening of the new South Niagara Hospital in 2028, the municipalities will determine how to best use the Niagara Falls, Port Colborne, and Fort Erie sites for the benefits of those communities. Our vision is for the municipalities to support community-run services such as team-based primary care or diagnostic imaging at the Port Colborne and Fort Erie sites, and we are in active discussions with them on how to move forward to do this. Niagara Health will no longer be operating the Port Colborne and Fort Erie sites after that transition. Okay, so I'm going to hand it back to Harpreet, and we will start some Q&A.
Thank you. We'll start with some pre-submitted questions. And to our panel, we can start. The first question we received was, there's a shortage of healthcare professionals across the
I want to assure you that our teams are doing absolutely everything possible to recruit more health professionals to all areas of Niagara. But we know that these shortages are going to continue for the foreseeable future. I think that when we have a brand new state-of-the-art hospital, we're aware that clinicians will be attracted to work in those new hospitals. We've seen that in the past. So we know that by 2028, and knowing that we're opening a new hospital, that will be one of the big attractions for people to work in Niagara. Also important to note that the new South site will be well certified, and basically what that means is looking at a healthy environment for our patients, but also for our staff. Things like sunlight, certain level of air exchange, healthy, nutritious food to eat, as well as exercise space within the hospital and outside space. So we know that staff will be interested to work in the new site. When the Murata family opened back in 2013, the St. Catharines site, we had an incredible amount of interest in staff, healthcare professionals working at that site. So we've actually seen it before, so we're pretty confident that we'll have the same thing again. Some of the other things we've done, though, we've been very aggressively recruiting from across the country, but also internationally for physicians as well as other healthcare providers. We've also been working with partners like the Niagara region to look at how we can be successful in recruiting people around, Niagara being an amazing place to work, to raise a family, to play. And so we've been working with them to sort of market Niagara for healthcare providers to move here. And then we've also been exploring different models of care. So where we know we will continue to have a shortage of a certain professional group, we've had to look at other models of care. An example would be the use of anesthesia assistants in the operating rooms where we don't have enough anesthesiologists. And supervised sort of nurse sedation is also a model that we can use in our operating rooms. And GPs who are trained in anesthesia can also do some cases. So that's just an example of us using some different types of professionals to substitute a little bit for some of the specialists that we're having an increasingly difficult time to recruit.
Thank you, Lynn. Will the new hospital increase MRI capacity for the region?
I'm very happy to say yes. So we have an incredible backlog of MRI cases due to the pandemic, but even prior to the pandemic, there was definitely a wait time that was unfortunately too long for people all across the province. So we've really been careful that with the opening of the new site, we're adding capacity for MRI. So in fact, there will be 2 MRI machines on that site, and that increases the capacity of the region by 74%.
And the last pre-submitted question we received was, how will I know which hospital I need to go for care?
So I think Angela talked about this really well. What we want to say to people that is there's no wrong door. You don't need to know exactly which hospital to go to for certain specialist care. If you have a medical emergency, or if you're feeling unwell and feel like you need to go to or emerge, you will be handled and stabilized and treated in that location. And if you require specialized care that location does not currently have, you will be safely transferred to the other location to receive that care, whether that's a certain surgical procedure or a certain diagnostic imaging test. So definitely we want the different sites to have different areas of specialty, but what we don't want is for patients to have to figure that out on their own. You'll also have noticed from Heather's example that our colleagues in EMS, our paramedic colleagues, also know after they evaluate patients within the environment, like home or wherever 911 is being called from, that they know where specialized services are, and sometimes they can make that decision themselves. So in the case that Heather presented, if it's obvious that someone's having a stroke, they would definitely take them to the Niagara Falls site, even if that individual was in St. Catharines or Welland. So we just want to say that there's no wrong door. Patients can go to any of our locations, and they will be safely transferred.
Thank you. We'll now go to the live